We're going to go ahead and get started with our afternoon presentations. I'd like you all to welcome Yuri Sanchez, who's going to teach us today about cultural considerations in the Latinx community during the perinatal period.
Well, hello, good afternoon. Hey, my name is Yuri. I'm a person in long-term recovery. My clean date is December 22nd, 2016. I am a mother of 7 wonderful, amazing children. I'm a parent mentor for Morrison Children and Family Services. And I work the Parents Empowering Parents contract, which is part of the family preservation that we're doing to keep kids in home while their parents are dealing with their SUDs. And I'm extremely nervous. I was presented with this opportunity to come up here and speak on my experience. I really felt like, oh my gosh, I don't have all these huge credentials. I didn't even complete 9th grade. I'm a teenage mom, like all these things, right? And I was like, what could they possibly learn from me? I really believe that. And the more that I talked to my support people, the more that I talked to people in this community, in this space, I realized that that's exactly what I'm bringing to you guys today, and that's my lived experience. Like, I don't have all these credentials, I don't have all this education, but I've been through some shit, So the objectives today are to develop the awareness of the ways systemic racism, bias, and stigma impacts Latinx birth outcomes. Create a shared understanding of how to incorporate culture into prenatal care and substance use disorder treatments. Learn how to access culturally specific resources for the Latinx community. All right. So some of the barriers to care from, there we go. Some of the barriers to care in my personal experience, because that's all I have to bring to you guys today, is the trust in the system. So just to give you guys a little bit of history, I was pregnant, I was 6 weeks pregnant, I was using, this was my 6th pregnancy. I was going through domestic violence with my partner. And I had already lost 4 kids to my addiction. I had already, willingly gave them away to be in my addiction. And I was just so tired of being tired. I just really felt like it was just, this is the end, right? Like the choices that I have right now are, I had this 8-month-old baby that felt like I had been given an opportunity to care for and raise, after losing 4 of my children. And I found myself doing the exact same thing that I had always done, right? And I didn't know how to stop, and I didn't know where to go, and I didn't know, like, who could I trust? My biggest fear was, like, they're gonna take my child, but I love my child, right? Like, I love my child. Why are they gonna take my child? Because I don't know what to do with myself. Why should this be, something that affects her, right? Without even knowing about the ACEs yet, I knew that this would impact her because I too was a foster care child. And I had my first child at 15, got pregnant at 14, and the system really failed to really see through that I finished school, that I had everything that I needed, that I was in a safe environment. So moving forward, I'm in this position where I don't trust anything that's about to happen. I'm being told that I'm pregnant, I'm using, I'm high, and I'm just in fear. So, barriers Latinx people face when seeking prenatal care. So for me, obviously I speak English, but I can come up here and represent that sometimes spoken language and understood language are 2 different things. In my experience, there have been times where as my role as a parent mentor, have experienced the systems trying to say, but we're providing this parent, Spanish-speaking interpreters, without really talking to the person and understanding that that person might not come from a Spanish-speaking community. They might come from a dialect-speaking community, and so what they're interpreting about what's being said in their language, they're not really understanding, right? Especially when we're talking about, like, what do you need to do? What challenges and barriers are you having? Just because somebody speaks a language does not automatically mean that they understand it. Family dynamics. So for me, what I'm speaking on family dynamics is that we might have like a 5-generational household, right, with completely different experiences with, being pregnant, with how to care for a child. Just because they're in these systems does not mean that they automatically are in alliance with one another on how like things work, or how to go about like even talking about like I'm pregnant and I'm using, like, what does that look like for me, right? Or like, you can't talk to your grandma about that if your grandma comes from some place where they didn't even have any prenatal care and they kind of just delivered on their own and used their own like community or their own family as like the midwives and the people that kind of delivered. That was my story. My grandma actually delivered all of her older kids' kids, so I know a lot about that. Shame and guilt, right? Like, I feel that in our culture, it is highly viewed at the disease of addiction as something that you can control. It is not quite understood that just because somebody is using, that they're choosing to use. They're not understanding like how our brains work, how they operate, and once we start using, like what happens, that we're kind of can't control it. So there's a lot of shame and guilt. And then pregnancy norms from other countries. Like I said, we need to keep into consideration and take into mind, what kind of environments immigrant people come from, that have transitioned here from Central and South America, and what that kind of looks like for them, and what kind of like practices they're accustomed to that are not always in line with what how we do things around here. Lack of trust if undocumented. I believe Talia already spoke a little bit on this, and there's a lot of fear and a lot of resistance to really believe that if you go seek medical attention, that you are safe in that environment, especially if they're misinformed or if they're like new. Some of the information that their community might be providing to them might not be accurate if it's not coming from a reliable source. And then also the most important is that if they are here from somewhere else, usually they're here alone, so they have no family support. They don't know where their tribe is in their community yet, So this is some of the things that we need to take into consideration, and just really asking those questions, and then really taking time to make sure that they're understanding the question that you're asking, because I've seen a lot of them just answer yes. To when you're asking them a really important question that will determine like what kind of care you're gonna help them kind of plan and provide. They're just gonna kind of agree with you because they don't really know. So really taking time to ask those kinds of questions. Sorry if I'm shaky too, I'm still nervous. Thank you. All right. Barriers Latinx people face when seeking substance use disorder treatment. So aside from already being scared and already being in fear of what's happening, we have a few culturally specific places that offer supports, but they're the only place that we know of, at least in Washington County, that does any form of inpatient treatment, and it's mostly for men, is in Madras. Now you can imagine if you have a family that you're taking care of and you have to go 3 hours away somewhere to be in an inpatient treatment, how difficult that must be on families. There isn't a lot of inpatient. There are a few outpatient places that have culturally specific staff, culturally specific curriculum, but it's not a lot. So that's a huge barrier, especially for moms, right? There's not like a Project Nurture culturally specific with all Spanish-speaking staff with different dialect. There isn't a lot of resources. There are some. I'm not saying there isn't any, but there isn't a lot that really gets put out there to make people feel like, oh, it's just accessible anywhere, in any corner that I see, right? You really have to know what you're talking about. You really have to know where to access these resources to really be able to let them know that there is a culturally specific place that might be able to accommodate their needs. And then also, like I said, we assume that if somebody is, of Latinx heritage, that they only speak Spanish. Like, I really just want for that to sit with you guys, that it's not just Spanish speaking that we're talking about here. There's all kinds of dialects that people from Central and South America are coming from. Lack of trust, or did I just read that? Am I going over this again? Okay, yeah, it's the same thing. Lack of trust, right? For undocumented, we're not fully feeling safe. Like, if I go in for an assessment, like, is a police officer going to be there to somehow, call ICE on me and arrest me, right? Like, we're not really knowing if that's okay for us to do, It could be as simple as like showing up to pay a parking ticket, right? Like, I don't know if that's gonna affect me in any way, shape, or form. Am I doing these kinds of like things that, for people who don't have to worry about that, don't really think about? And once again, no family or community supports because they might be here and haven't established that yet. All right. How stigma shows up when working with members of the Latinx community. Not completing thorough or accurate screening. And once again, I'm gonna go right back to like, they're answering questions for these screenings with like not the understanding of what is really being asked of them. So we need to really be mindful of that and really ask, Making assumptions about someone's progress, needs, or barriers. So how this shows up is you can't expect that because maybe you know of one culture that the next person, just because they look a certain way, will come from the same kind of culture, or that they're experiencing the same similar things, and then not progressing. So if somebody comes in, if I'm a mom that's using, which I have been a mom that's using, and like in the harm reduction arena, right? Like, I was smoking meth, but now I just smoke weed. Like, that's still a harm reduction. That's still a change that I'm making. That's still something that's strength-based that can be documented. Not just like huge outcomes, but even little outcomes definitely should also be documented in progress. Language and terminology. This is huge for me. English is my second language. And even me, with years of being here and speaking English, I still have a really hard time like understanding what some things mean, because to me they mean something completely different in my language, So really just taking time to especially like big words like what does that mean, like really being able to have time to sit down with somebody and explain what some of these big terminologies mean, especially in like the medical system and the treatment system. A lot of us don't come from places that language is commonly heard, and so we need to be able to be mindful of that. All right, how to incorporate culture. Now we're getting into the spicies. Just kidding. Just thought I'd be funny, sorry. It's not that serious. All right, how to share cultural beliefs and values impact pregnancy. People are less likely to seek care. Like, come on, we're just keeping it real over here, right? Like, for me, my other pregnancies, the one before the one where I actually got help, I was smoking a lot of weed. And I would do this thing where I thought nobody would know because I would quit like a week before, right? I wouldn't smoke a week before my appointments. The whole time it's showing up. They're just not telling me that it's showing up. It's just a concern that they have, right? But I'm thinking like I'm finessing the system somehow. And so for me, like, I didn't want to seek care for that because I was scared of the judgment. I was scared of the reporting. I was scared of, every time I showed up, what my doctor was going to say to me, or like how she was going to treat me, or, like I said, I was a foster care kid, so for me going into the doctor and telling anybody, even if when I peed it burned, anything that had anything to with my wellness, I was scared to report to anybody because I was scared like what next treatment, or am I gonna lose something, or am I gonna have to go away? Like I had trauma behind that, So trauma, fear, all of those are things that keep people from seeking help, during their pregnancy. And then another thing too is a lot of us come from a culture where if you don't make a lot of money, you don't have health care, And a lot of us didn't even know for a long time that you could go get free health care, So you have these families that are just going to the emergency rooms for like absolutely I'm dying case scenarios, So as long as like I can feel the baby moving, as long as I'm eating, and like we have these beliefs that if you're doing certain things, you should be just fine, right? Until you get to the situation where you're delivering, and then you have all these complications. But a lot of it is resources too, right? Like if I don't have the money and I can't afford it, and misinformation, I'm not seeking no help. And then, once again, there is no trust with immigrant status or how the culture views health needs, Like I just talked on that a little bit, A lot of us come from places where, like, we weren't taken to the doctor every 6 months or once a year for a checkup, right? It was on, like, if you need it type basis. And then, historically for us, there hasn't been a lot of trust built. There was times where anything that was different from what like your provider was doing and you're doing, was reported because it was wrong. All right, how shared cultural beliefs and values impact substance use disorder. Drug use is viewed as something that can be controlled, not a disease. So in my own experience, working in the field, and then also, a person that identifies as a Mexican, it just was always viewed as like, if you drink alcohol, like, that's fine. Like, oh, yeah, it's great, If you do drugs, though, like, you're bad, like, you're completely bad. And in my experience, alcohol is a drug, It does something to you, and it makes you, whatever. Like, it is a drug. And so it's really hard for somebody who's using to be able to kind of go to your family and say like, hey, I'm having an issue with this. I just found out I'm pregnant, and what can we do? How can you guys support me? How can you help me? If every weekend we're throwing parties and we're drinking, it's not viewed like it's every weekend we're, smoking meth outside, right? It's like it's really culturally different and acceptable one over the other, to the point where a lot of us find it so hard to maintain our recovery because of that, especially when we're using. Because if you see me drinking and I present drunk, right? But I'm really like smoking in the back, like just because I want to mix in and not let you know, because then you're not going to get on me about what I'm doing, right? All right. Ways to improve experience in treatment. When I've worked in culturally specific environments, and then throughout my own recovery journey, I incorporating of the music that I like to listen to and the language that I enjoy, the food, like special holiday observations, and then other like culturally specific things that the people you work with lets them know that you see me, you hear me, and you accept me. through, some of that. I've came into different places where, you know, where if you want to do all these things, you don't feel safe because it's like might just be you. You know what I mean? So really just when you're working with people who are, especially moms who are using, just allowing them the space to be able to do that, even if it's something that you don't enjoy yourself. A lot of people are like, oh, I can't stand that music. It's too ta-ta-ra-ta-ra, like whatever, like just enjoy it. It's not about you, it's about them. Asking patients about their spirituality and faith, right? I can say that in my culture, spirituality and faith is highly regarded, and being able to explore that, right? Just because you're in I'll give an example. Just because you're in like a group setting and there might be 3 people who don't believe in that there's a God, right? But you have this one person that maybe is quiet, reserved, off to themselves, and you're starting to notice that they're uncomfortable about it, right? Like maybe like pulling them aside and asking them a question and understanding that in our culture we do view religious as something that's highly sought, and just understanding that we value spirituality a lot. When supporting Latinx people through pregnancy and substance use treatment, incorporate their family into their treatment plan. And I would just advise that you always ask the person first, of course, but I do, and once again, I'm not up here trying to be like, I'm not like a professional. I really am not. I just have lived experience working with the families that I serve, and I've been a consumer of all these resources and all these programs. And so all of this, is open for interpretation. It's open for perception. Like, whatever your view is on it, great, fine. This is Yuri's perspective on this matter. And yeah. So if we have other Latino people in here, yes, I welcome you to talk to me afterwards and either give me some good pointers. Maybe I leave some things out. Maybe I need to add some things in, whatever, right? I'm just really up here just trying to speak on my own experience. But yes, for me, family was very important to incorporate into my plan because what I was noticing happening was that, and not this time around, but before, was that I was able to be like, yeah, I'm going to tell these doctors what they want to hear and that I got all this stuff going on and I'm going to do all this stuff. And then my mom, my cousin, my uncles, they wouldn't have to know anything about it, so I wouldn't have to follow through with it, right? So then in my environment where I am actually residing in with the people that actually can support me and help me if they say, hey, Yuri, you're getting a little angry, don't you think you should go to that meeting over there? Where they could really support me and walk with me through this journey, especially while I'm using, right? Because I'm going through all kinds of feelings and emotions and I'm not always gonna know exactly what I need. And so for me, having my family supported and incorporated into my treatment plan was important. Multi-generational households are very common, like I said. You might have, like I said, a great-grandma, a grandma, a mom, a daughter, and then her kid, living within the same household. Okay. All right. Incorporating culture into outreach. So when you're doing outreach and you know that you're going to be talking to, some of the Latinx community, just please be mindful and be sure that you're speaking the language and not just Spanish, or that you have some kind of resource or know of any resources that you might be able to use in interpreting, like apparatus or like a telephone or something that might help you with that. Music, we love music. I love music. Identification, it's really important for me when I got clean. My sponsor, she always shares about that when she was in the rooms of recovery, she didn't see a lot of people like her. And so when I see somebody walk in, I always make sure that I introduce myself to them and that I say, hey, I'm Yuri, and what's your name? Just because identifying with somebody and being able to see yourself through their eyes, can make or break like that connection that you might have in the exploration of like where, you might be able to go. And so being able to see people that look like you in these resources, in these places, makes a big difference on like how people will open up and trust what they're doing. Basic needs met. So, a lot of times we're very prideful people and we don't like to say that we need help. And so I would say if you notice, really just, everything's always about communication, right? And really being willing to open up and ask a lot of questions. And just knowing that that's the only way to receive answers is really just talking with somebody instead of just like sitting there and being like, okay, let me check my checklist. Like, I did this. Like, really sit down with someone and be like, hey, how you doing? Whatever, more like human to human contact versus just like, I'm a professional and you're this, and then this is what we're doing, and then that's that. Like, in my personal experience, like, the people that got to me the most and made me really want to change who I was and really trust the system were people who were genuine, who were honest, who shared their lived experience, and who gave me hope that I could do the same thing. So always just making sure that you help somebody meet their basic needs, and that you always have like culturally appropriate, resources for them. Sorry, I'm getting emotional. Incorporate culture in prenatal care. Incorporating culture in prenatal care. Ideally, centers that are culturally specific with staff, care providers, they can identify with, like that's very important. I want to be able to like talk about novelas or, like talk about my abuelita or, be able to speak Spanglish and I don't have to like, translate for you, like that kind of stuff makes it easier for people to just really work on themselves is when they can see themselves. Being able to create trust to help deal with deep-rooted issues. So just really having a clinical team that, can understand kind of like, how Talia was talking about, just what are those deep-rooted issues, because most of the time in our culture too, it comes from like so many traumas, the immigrant experience is, it's not an easy journey. It's not an easy decision. And it's not something that usually comes from like, hey, I want to take a trip and go have a fun time in America. So, just really understanding like the population of people that you're dealing with, and really having a kind and open mind about their needs. Seeing people with lived experiences and able to support and guide them. That to me was crucial and essential on my journey. When I first was clean was, I'm a Project Nurture participant, and thank you. Yes, thank you. And I'm actually one of the people that Talia was talking about. Talia was my doula at my son's birth. And their lived experience and knowing me, even though they weren't culturally specific, they understood my culture, and they understood where I came from with my culture. And they were able to always like give me so many resources and so much like information on where I could access like that for myself. And I found my community, of like people that were like me, that I could identify with, that I could draw hope from. All right. Incorporating culture into SUDS treatment. We see better outcomes, less children involved with the child welfare system when we do this. I'm, like I said, I am a prime example of what that can look like if you surround somebody with the right supports and you really take your time to get to know somebody. Quicker willingness to treatment and recovery. So In my experience, that's what allowed me to say, yes, I need the help, and yes, I want it, and where can I find it? Trust in the system with more people to receive services. And then, so what happens in our community is like when you receive really good service and when you receive good outcomes, what happens is like these communities talks amongst each other, right? Like they're going to church together, they're going to the local food banks together, they're going to different kinds of arenas and places, shit, even a fucking quinceañera or a dance. And they're telling each other about this, right? Like, oh, did you hear so and so? And you know, the message gets spread around in the communities, like where you can go, what you can do, and that there's these services and these things available for you, right? So always making sure that it's the ripple effect, right? Like whatever you do within your organizations and your environment and your systems, like those things get spread out and that information gets taken somewhere else where it really might be needed. And then also for asking for help sooner, right? So if I'm somebody that's using, I can't go to my grandma and say, like, 'cause my grandma's gonna judge me and be mad at me because I'm smoking meth in the back, you know, and I'm pregnant now, what do? I can't go to her. So if I know that there's these places, right, that are like, that understand my situation, that will support me, that will like love on me and push me in the right way, it'll make me wanna hopefully, make me wanna go out and seek these helps and get them sooner, right? All right. Success story. Connected clients with culturally specific peer support providers. So like I said, you know, I'm going to give you guys a little bit because I feel like this is a good pause for me to really let you. I was 4 years old. My mom was in DV, my dad was drinking, my grandpa was already established here in Oregon with his family, was working at the Oregon Gardens, and he hears of what's going on in Mexico. So he goes to Mexico, he gets my mom, I come from a family of like my grandma had 14 kids, and my mom's the second to oldest. And so they're already living here, they're already established here, and me and my mom are in Mexico with my dad. So when they find out all this stuff is happening, he goes and he gets us. So my grandpa carried me on his shoulders across the Rio Grande and brought us to America. And every year we would go back as soon as they were done with like the farm work. In the winter, there was no work, so they would all go back to Mexico, and they would be there for 3 months. So every year, we would land in a new place. We would go to a new school. And so I would have to get smuggled across the border in different kinds of ways every year because I was undocumented. I didn't get my papers till I was almost 20 years old. Nobody ever thought to file for me, so I actually was undocumented for a really long time. So, you know, as I'm going through life and I'm going through all these things, that is always a fear of mine. That is always a fear because anytime I want to get help for anything, anytime that anything would happen, like that fear of like somebody's gonna call immigration on me, I'm gonna get deported, I'm gonna go somewhere where I don't know where I'm gonna go, you know, just these fears prevented me from like accessing so many things in my life. So when I get pregnant and now I have this information, right? Now I know what my rights are, now I know who can help me, now I know that I'm not gonna get deported every time I fucking sneeze, that I am safe. That's when I started being able to really access some of the supports in my community. And that was important because a lot of that information gets translated by the people that you trust, and usually it's the people that look like you that you trust the most. Incorporating trust, thank you, abstinent family members into treatment. So, for me, I was a foster care kid, so for me that was a little bit hard and a little bit different, but on some of the moms that I do support today, I do notice that they do come from very supporting, loving, like, families, and like I said, there's like usually like a grandma and aunt, and lots of cousins, and these are families that live in, in the homes. They could be small homes, a lot together, and so incorporating them into a treatment plan, in my experience, has been very successful with the moms that I'm working with, because it allows for everybody to be in the same page. And I always ask the mom, right? Like, I always ask the mom I'm working with, like, who do you want to be in your support? Because she might not feel safe or trust somebody in that household. And so really knowing if they even want to, not just assuming that they do, but asking them if that's okay to do and if that's something they want to do. But yeah, like usually, like all the people are usually really, really happy and ecstatic once they know the information, right? Once I sit down and explain to them, like, no, your daughter's not using just because she wants to, you know what I mean? Like, your daughter's using because whatever, right? Like I said, if the daughter allows me to share this information with the family, but once the families realize that, like, the daughter wasn't like doing it just because she wanted to, but because it's a disease, and explaining that information to them, in my experience, it helps them kind of have a better understanding, and they're willing to support the children, the moms, especially the using moms. Connections to community resources. So some of the community resources that I've been able to access and that I suggest to my moms to access is El Jardín, that used to be known as Instituto Latino Northwest. Now they're known as El Jardín, Latino Network, Juntos, and Puentes. These are all some of the culturally specific for the Latinx community. If I miss any, please educate me, let me know. I would love to get a lot more on here. I think it's always, great to like expand that networking. Natural and organic communication during and between visits. So, that has also been something that I've been working with a lot of my moms to be able to really ask a lot of questions when they're in their visits and when they're dealing with anybody, whether it be the child welfare system or, the hospital system, the prenatal care system, like all of that, those systems, like really just being safe and knowing that they can ask as many questions as they need to, and also making sure that you connect them to somebody that can support them, because sometimes they won't feel safe asking these questions, and they really do need somebody to hold their hand through these processes. Resources and opportunities for connection. So we got the Immigrant and Refugee Community Organizations, IRCO, Linguava, National Interpreting Services, Oregon Certified Interpreters Network, and your local Google, no, I'm just kidding. Organizations, so like I said, we have the Latino Network, Oregon Latino Health Coalition, Virginia Garcia, El Jardín, Latino Network, Juntos, Puentes, Project Nurture, Morrison Children and Family Services. So I also want to just kind of talk about kind of like my role at Morrison. So I'm a parent mentor, and I work the Parents Empowering Parents contract, and it falls under the family preservation. So I'm really working on I'm part of a case study, which basically what we're trying to do is we're trying to get parent mentors in all the states. We want it to be federally funded so that every parent that's going through SUDS and has children or is pregnant and using will be able to keep kid in home and not have to go through the court system. Yeah. And so it is a case study contract where we work with families, and we are able to provide to work with them more time than traditional parent mentoring. And for me, this is really important because when I was a foster care kid at 11 years old, and I just remember my mom had a really hard time understanding what the DHS workers were telling her, My mom had a really hard time understanding like what the abuse that I was experiencing, like the impact that it had in my life. Um, my mom had a really hard time showing up for me because she didn't know what I needed, because it wasn't presented to her in her language at the time. Um, and so I feel like my mom missed out on an opportunity to really be able to care for me and really like protect me and really like walk with me through that process because of a cultural barrier that she was experiencing. I feel that I would have been a kid that could have stayed home. I feel like if my mom would have had the information of like the impact that her decision that day would have made on my life, that she would have made, I absolutely believe that she would have made a different decision for herself. Sorry, I'm very emotional. Um, Thank you. Thank you. Um, Thank you. So this project is very near and dear to me. I really believe in what we're doing in our community, and I really believe that we, through our experience and through our advocacy, are going to be able to change that system. I believe that at the core of my heart. I believe that one day anybody that's using is not going to get their kids removed from them. I believe that one day they're going to get all the resources that they're going to need. I believe that they're going to be able to work with somebody that could really like walk with them through that experience. And I'm looking forward to that day because I feel like everybody that I've been in contact with and everybody that I've had the opportunity to work with, everybody that's helped me in my own personal journey, like that's what we needed, right? We needed somebody to believe in us. We needed somebody to give us the information. We needed somebody to draw this hope from. And yeah, so please, if you work in a space, especially for moms that are using, where you already know what's gonna happen, you already know kind of like, you know, we're using and what does that look like, right? Like really developing these relationships, really advocating for your moms, and then really, you know, trying to really utilize, there are certain criterias to the Parents Empowering Parents study, so we can talk about like what those look like more. We can always present as well in your organizations to give you guys more information, but just really know that there's this program that has been set in motion, especially for the BIPOC community, because those are the kids that have been displaced out of their homes more than any other ones, that we really want to keep kids in home, and we really want to make a difference, and we really want this to work, and we want that information everywhere so that all the agencies and all the people working with these families can really advocate for that. Like, what about, do they qualify, right? Do they qualify for Parents Empowering Parents case study, you know, and then maybe like you guys having enough information within your own organization to say like this is what it is, right? Because me as a parent mentor, I can't go and tell the parent like, hey, you're gonna work with me and it's gonna be great and like these are all the cool stuff you're gonna get, right? It has to be something that I start working with them once they decide to. So as organizations that are working with moms that are using, you know, maybe we can like all collaborate and work together to get this kind of like more referrals in and really get this up and running so that one day no mom that uses ever has to lose her child because she just doesn't know how to change or where to go or what services are available for her. So, oh my gosh. I think I'm done. I think I survived. Okay. Questions? I mean, hold on. Time out. Just kidding. Hold on. I just really want to say thank you to everybody that is here, because you guys are actually like making a difference to actually do something about the shit that people like to complain about. You are actually here in a space of change. So thank you for being here. I really love what I get to do because I've seen so many moms reunify with their kids who didn't even know where to start. And every time that I see somebody be able to live with their kid, it's like I'm healing the broken part of me that never got to go back to her mom. And so I'm grateful for everybody here because I know that through this, you will create change as well. There's no way that you can see the presenter earlier, the panel earlier, me, and not want to do something different for these communities. So thank you for being here, and now I have questions. Okay, now I have questions. And if I don't know how to answer them, I'm going to say I don't know.
All right. First, I want to thank you so much for getting up here and telling us your story. It is so valuable. Thank you. And
What's your name?
my name's Amber.
Hi, Amber.
Hi. I wanted to ask you, I'm first generation I'm American. My parents are from Mexico, so hell yeah. My question for you is, as you're navigating care, right? I know like things like food and sharing that is such a big way to connect with our community, but some of the things they tell us professionally not to do. How do you navigate that and connect with your community?
There's a lot of ethics and things that you have to work around. Me personally, if I know I'm doing something that's culturally specific to my culture, I have those conversations with my supervisor and I say, hey, look, I'm not supposed to receive food from this family when I go there. I'm supposed to be like, oh no, I can't eat your food. But I always tell my supervisor, like, if she offers me a taco, I'm gonna eat it. Because I want to build rapport and trust with her, and what the ethics say that I can't do, in our culture, we do. So I just always have really honest and genuine conversations with my organization to let them know, like, there's things that are different that you might not understand, but in order for me to continue to build this trust and rapport, like, I gotta do this. Sorry, not sorry.
I just wanted to add, you said add a resource, Doulas Latinas,
Thank you.
or the Community Doula Project.
Thank you. Can I get that info from you, T?
The Verse Doula Project, the Verse Doula, yeah. Yeah.
Latinas.
So you can go to CDA, you can go on CDA's website, and they have the Diverse Doula Project. Kimberly Porter is the director over that program, the owner, founder, director over that program. And they have doulas that are culturally specific to, they have Pacific Islander doulas, they have doulas, Latino doulas, they have African American doulas, they have African doulas. And so that is a place that if you are looking for a specific culture that may not be available, CDA probably has it.
Thank you, T. Talia. Sorry. Dang, y'all ain't got no questions?
Well, you covered it so clearly.
Thank you. Thank you.
So we've talked about partners earlier, and my question is, we've talked about moms in your community, and my question now is about the dads and supporting them
Yes.
in your culture.
Yes. So, I think it was already just said here, just ask, just ask and see what they're willing and what they're not willing. We do have a very macho community where, the men don't, like, that's the women thing. I don't want nothing to do with it. I'm going to trust you. or no, you can't do that, you know? So I think it's just on a case-to-case basis, kind of just having conversations, seeing where the mom is at with all of that, you know, to see like where the willingness is. But I definitely feel like there's misinformation, and so you don't know until you know, right? And you don't know how willing the partner is willing to be part of all the care. Sometimes the partner thinks he can't be part of the care, you know, is actually where it's at, because maybe they want to, but maybe he believes because of where he comes from, or, you know, what he saw, that the men don't participate in any of this. So I believe for the care of somebody, a mom that's using, you really just kind of have to like just ask a lot of questions, build rapport and trust to make sure that that mom is going to feel safe sharing that information with somebody. And then, yeah, always allowing them to make that decision on if they should participate or not, if they want to participate or not, but leaving that space open for them to be able to if they do. Yeah, definitely.
Hi, one more question. You kind of covered it about the cultural lens on alcoholism and other sorts of drug use. So when you encounter that, how do you approach it? Like having conversations about other drug use and alcoholism in the home. How do you explain alcoholism to some of this is a loaded question, but just because it's so a part of the culture.
Right. The way that I've done it to moms that are like, you know, not believing like, oh, eso es una droga, you know, that's a drug and alcohol is not bad. And if it was that bad, why would it be everywhere? And it's kind of like just going back to the science of like, what does it do to you? You know, what it does to your brain? Like, what kind of decisions do you make, you know? And still making them understand that just because it's viewed as like something more social, that it's not still having those same effects, you know, with like DUIs, or, you know, how they treat people, or, you know, how they feel about themselves, or just, you know, some of the consequences that they suffer from their using, and letting them see, like, doesn't your son who drink going to jail and doing all these things too? So just kind of really giving them information on how alcohol is a drug as well, you know, and all of the effects of that. And then, like I said, usually it's just a misinformed person who just is going off of kind of like a social, because my mom never drank, you know, and so she didn't even understand what it does to you, you know, so she just was like, oh, you just don't drink and you just, nothing will happen. And it's like, no, that's not how it works, mom, you know, like, so just having conversations and being able to provide a lot of information to the family, you know, to whoever's part of these appointments, or whoever's part of their treatment plan, like, you know, just really giving a safe space to be able to, oh, I just broke my pen, to ask these questions. Yeah. Una más.
Hi, I'm Brenda.
Hi, Wenda. What is
Thank
it?
you. Brenda.
Brenda. Hi, Brenda.
Thank you for being here and sharing your story and for your vulnerability. And it's amazing what you're offering to people every day and what you're offering to us today.
Thank you.
My question is just whether you ever interface with CASA, court-appointed special advocates. I don't personally know very much about what they are like here locally. I know some people in another state who work with them, but people that work in another state, their focus is all about the kid and what's best for the kid, and I don't know that they always get the education and the perspective of what's best for the kid is to be with their parent, and
Correct.
why that's so important.
Yeah, so out in Washington County, the parent mentors actually take time to meet with CASA and kind of go over, like, you know, we usually will pick like 2 or 3 of us to share our kind of like our story of like our child welfare journey and experience, to be able to have workers also be able to identify with the parent part of it as well, you know, and all the barriers and challenges the parents have to go through as well, navigating all that system. So for us, collaboration is key and essential as well. Yeah. Ooh. That's it? No more questions? We done? Yep. 2 more minutes.